For more anatomy related videos, please subscribe to my channel, Learn with Dr. Tanya Hashik.
Hello everyone, in this video we will discuss about teeth. Here I am only discussing the general anatomy of the teeth. We are not going in detail. So teeth, they are structures which are helpful in mastication or chewing, and they are embedded within the jawbone. So they are embedded within the jawbone. And in case of human, there are two sets of teeth. That is a set of deciduous teeth or milk teeth, also a set of permanent teeth. So deciduous teeth, they are milk teeth, that is, it is present during the childhood and it is replaced by permanent teeth. In case of humans, the teeth, it is only replaced only once in life, and hence it is called as the diffeodont. That is, it is only replaced only once in life. But in case of other non-mammalian vertebrates, it can be replaced many times, and hence it is called as the polyphyodonts. In case of humans, it is called as the diffeodonts. So what is the dental formula for the milk teeth and also the permanent teeth? In case of human, the dental formula for the milk teeth, it is 2102. That is half of the jaw. That is, the half of the jaw, it has got total of 5 teeth. That is 2 incisors, 1 canine, 0 premolars and 2 molars. That is in case of children. But in an adult, it is replaced by permanent teeth, and the dental formula for the adult, it is 2123 in case of half of the jaw. That is 2 incisors, 1 canine, 2 premolars and 3 molars. So in case of children, there are a total of 20 milk teeth. That is 5 into 4. That is, in each half of the jaw there is 5 teeth, and 5 into 4 there is 20 teeth in case of children. And in case of adult, that is in case of permanent teeth, there are a total of 32. That is 2 plus 1 is 3 plus 2 is 5. 5 plus 3 is 8, and in total there are 8 into 4, that is 32 permanent teeth in case of adults. So the difference is that in children there are no premolars, and also there is only 2 molars. So now we will discuss about the parts of a tooth. So a tooth, it has got 3 parts. This is the crown, this is the neck, and this is the root. So this is the crown, this is the neck. The small part is called as the neck, and this is the root. So how will you explain a crown? It is the part which is projecting above the gum. The part of the tooth which is projecting above the gum is called as the crown. And the neck part, it is the part in between the crown and the root. And the root, it is the part of the tooth which is embedded within the jawbone beneath the gums. So the part of the tooth which is embedded within the jawbone beneath the gums is called as the root, and the middle part in between the crown and the root is called as the neck. So these are the 3 parts of the tooth. So now we will discuss the structure of a single tooth. So the innermost part, that is the center, there is the pulp cavity which is surrounded by the dentine. So this is the pulp cavity which is surrounded by dentine, and the projecting part of the dentine, it is covered by enamel, and the embedded part of the dentine is covered by the cementum, and the periodontal ligament or membrane, it keeps the tooth within the socket. So these are the structure present in a single tooth. So innermost there is a pulp cavity. The pulp cavity is surrounded by dentine, and the projecting part of the dentine, it is covered by enamel. The embedded part of the dentine is covered by the cementum, and the periodontal membrane or ligament, it keeps the tooth in position. So these are the part of a single tooth. So first we will discuss about the pulp and also the pulp cavity. So the pulp cavity contains the pulp. the pulp, it is made up of loose fibrous tissues. It contains blood vessels, nerves, lymphatics, etc. And the pulp, it is surrounded by a layer of tall columnar cells, and they are called as the odontoblast. So the pulp, it is surrounded by a layer of tall columnar cells called as the odontoblast, and they are capable of replacing dentine at any time of life. And these blood vessels, nerves, etc., it enters into the pulp through the apical foramen. So this is apical foramen, and this is the foramen through which the blood vessels, lymphatics, etc. enter into the pulp cavity. So the pulp, it is surrounded by dentine. So what is dentine? It is made up of calcified material. That is, it is made up of calcium and also phosphorus, and this is harder. That is, the dentine, it is harder compared to the bone, but it is softer compared to the enamel. So it is one of the hardest material present in the body. And the projecting part of the dentine, it is surrounded by the enamel. So enamel, it is the hardest material which is present in the body. So it is the hardest material which is present in the body. So the embedded part of the dentine, it is surrounded by the cementum. So cementum, it is one of the hardest material, and it also do not have any blood supply or nerve supply, and at the region of neck, sometimes the enamel, it is overlapped by the cementum, and in some cases it is not overlapped, and in some cases there is a gap between enamel and cementum. And next is the periodontal membrane. So the periodontal membrane or the ligament, it holds the whole teeth within the socket. So it holds the teeth within the socket. So these are the structure of a single tooth. So innermost is the pulp cavity, which is covered by the dentine, and the overlapping part, the projecting part of the dentine, which is covered by enamel, embedded part by the cementum, and the periodontal ligament, it keeps the tooth in position. So next we will discuss the form and function. So now we will discuss the function of each of these teeth. So first is the incisors. Incisors are the teeth which are present in front. So these are, in total there are 8 in number. So in one side there are 2. So they are also called as the cutting teeth. So what are their function? It helps in cutting movement. So the incisors of upper and lower jaw, they act as the blade of scissors, and it helps in cutting movements. Next is the canines. So canines, in total there are 4 canines, and they are helpful in tearing movements. So the canines, they are helpful in tearing movements. Next is the premolars. The premolars, they have got 2 cusps. So they are called as the bicuspid teeth. And next is the molars. So molars, they are 3 in one side of the jaw. So in total there are 12 molars, and they are helpful in grinding movements, and they have 4 to 5 cusps. They are helpful in grinding. So one of the similarity between the incisors, canines and premolars are they have only got a single root. That is, they have only got single root. But in case of upper first premolar, it has got 2 roots. That is, in case of upper first premolar, they have got 2 roots. And the molars, it has got, the lower molars, it has only got 2 roots, and the upper molars, it has got 3 roots. So incisors, canines and premolars, it usually have only a single root, and the exception is in case of upper first premolar. And the molars, the lower molars, it has got only 2 roots, and the upper molars, it has got 3 roots each. So now we will discuss about the eruption of the deciduous teeth. That is the milk teeth. It erupts by 6th month. and it completes the eruption by about 2 years. And the tooth of the lower jaw, it erupts slightly earlier compared to the tooth of the upper jaw. So it erupts by around 6 months and it completes by around second year, and the eruption of the lower jaw, it is slightly earlier compared to the eruption of teeth of the upper jaw. So now we will discuss about the nerve supply of the teeth. So nerve supply, it is from the trigeminal ganglion. The trigeminal, that is a sensory, it is from the trigeminal ganglion, and it divides into a mandibular nerve and also the maxillary nerve. Mandibular nerve, it supplies the lower jaw, and the maxillary nerve, it supplies the upper jaw. And the mandibular nerve, it divides into, it forms the inferior alveolar plexus, and the maxillary nerve, it again branches into posterior superior alveolar nerve, the middle superior alveolar nerve, and also the anterior superior alveolar nerve, and it supplies the upper jaw. So the nerve supply, it is from the trigeminal ganglion, it divides into maxillary and the mandibular nerve, and the mandibular nerve, it supplies the lower jaw, and the maxillary nerve, it supplies the upper jaw, and it branches into anterior superior alveolar nerve, the middle superior alveolar nerve, and also the posterior superior alveolar nerve, and it supplies the upper jaw. So today we discussed about the anatomy of the teeth. So in case of human, there are two set of teeth, that is a set of permanent teeth and a set of deciduous or milk teeth, and there are a total of 20 milk teeth and a total of 32 permanent teeth, and the parts of its teeth are crown, neck and root. And the structure of tooth, it has got a root, a dentin, enamel, cementum. The periodontal ligament is embedded within the alveolar bone. And then we discussed about the eruption of the temporary teeth. It erupts by about 6 months of age, and it completes eruption by about 2 years. And then we discussed about the nerve supply. So it is supplied by the trigeminal ganglion, and it divides into maxillary and the mandibular nerve, which supplies the upper and the lower jaw. So this is the end of today's class.
This is the end of today's video. For more videos, please subscribe to my channel and press the bell icon.